Welcome to The Coalition. This is a talk show dedicated to discussing health, wellness, and inspiration. I'm your host, Dr. Shani Belgrave. Hello, everybody. Welcome to The Coalition. I'm your host, Dr. Shani Belgrave. I am a bariatric and minimally invasive surgeon. You can learn more about me and get connected at www.drshanibelgrave.com. I'm delighted to welcome to the show today Dr. Shenelle Wilson. Dr. Wilson is a urologist with a subspecialty in urogynecology. She's also the founder of Metro Atlanta Urology. Dr. Wilson joins the show today to tell us what we need to know about prostate cancer. Dr. Shenelle Wilson, thank you so much for joining the coalition.
Thank you so much for having me. Excited to be here.
Awesome. So I know this is going to be a super impactful episode, but before we get into it, I just need to let our viewers know something. So I need to let our viewers know that, like myself, you also grew up in Silver Spring, Maryland. So I have to give a shout out to the DMV area code 301. You already know what it is.
Absolutely. Suburban Silver Spring.
All right, Dr. Wilson. So now that our viewers know that you were also from Silver Spring, Maryland, what else can you tell them about who you are and what you do?
Yeah, well, like you said, I'm a urologist and I'm also a urogynecologist. And I also have a nonprofit organization called Urology Unbound, which is dedicated to increasing diversity in urology. So I just try to tackle, healthcare and wellness from a kind of pelvic perspective, but really trying to make sure that we have all the information that we need and that also we get accessible care across the board.
That is extremely important. So I'm so grateful that you agreed to join the coalition to raise awareness for Prostate Cancer Awareness Month. So can you just get us started by telling us about the magnitude of the problem? How common is prostate cancer?
Definitely. So prostate cancer is, it's a very common cancer. It's one of the most common cancers that we see in men. And, oftentimes folks are wondering whether it's a genetic predisposition, who's going to get prostate cancer. And what I tell folks is that there are people who have a genetic predisposition to it. There are conditions like BRCA that we know of that can increase the risk of prostate cancer. But it also can just happen. And so we know that most men, when they get autopsies in older age and they look at their prostates, they find prostate cancer. So it's something that is very common. It's really a question of whether or not it is clinically significant, if it's high grade or low grade, and what age it affects you. Because oftentimes, if prostate cancer affects you at a later age, it's just not going to become something that impacts your life during the natural course of life. So it's a bit of a complex question, but it's definitely something that is very prevalent in the United States and all over, and is increasing in its prevalence.
So yes. Dr. Wilson, what are some of the risk factors for prostate cancer?
So some of the risk factors for prostate cancer are age. That's really the main risk factor. We know that when we do autopsies in men of a significantly advanced age, almost universally they have prostate cancer. So age is the main risk factor, which is why we start screening for prostate cancer at age 50 for those who have not an elevated risk of prostate cancer. There's also a higher risk in African American and Caribbean men of African descent. So we tend to start screening those folks earlier at about age 40 to 45. And anybody who has a strong family history of prostate cancer. So if, a father or uncle, somebody in the immediate and near immediate family got prostate cancer at an earlier age. Now, if they got it at age 70, then we're still screening normally. But if they got it at age 50, then we know that might be more aggressive. There could be a genetic predisposition. And so those gentlemen will start screening earlier.
And what does screening entail?
So screening entails getting a blood test called a PSA, prostate specific antigen. And We also do a digital rectal exam, feeling the prostate for any lumps and bumps that are abnormal. And many times I have patients who ask, why can't we just do the blood test? And the reason is because some of the more aggressive prostate cancers actually don't cause a significant increase in the PSA ever, or not until it's even later stage. So we do want to feel the prostate also. And then there's also times where we can feel a nodule prostate cancer there, but the PSA just hasn't responded yet. So it's really important to do both of those things for the screening.
And that should be done annually?
That should be done annually.
So when we were just talking about risk factors, I wanted to make sure we touched on diet and weight, because there's some association between prostate cancer and obesity. In your experience, what would you say in terms of diets? Are there certain things like diets that are high in red meat and other things that increase?
Yeah, exactly. And I think that we've really found that with cancers overall and our overall health, that we know that when we are closer to a plant-based diet, we tend to have less chances for any kind of cancer. Definitely prostate cancer is not immune from that. So also making sure that we have enough vitamin D. So we know that there is a link between prostate cancer and vitamin D, having low vitamin D levels. So that's something that I often screen for in my clinic, just in terms of wellness, and make sure that I advise my patients and get them treated for if they have a lower vitamin D.
Well, that's really great information. Thank you so much. So, are there certain symptoms that patients should be on the lookout for as an indication that they may have prostate cancer? Signs or symptoms?
Yeah, great question. So there are signs and symptoms of prostate cancer, but if you have signs and symptoms of prostate cancer, that usually means that it's advanced, because prostate cancer is in general very asymptomatic until it has become metastatic. It usually will then go to the bones and people will have bone pain, or you can have weight loss, which happens again with a lot of metastatic cancers. So that's another reason it's so important to screen, because it's much better for us to catch it early, and then be able to do a surgical or a radioablative treatment that can really catch it when it's organ confined, and we can really control the disease that way.
Right. And so you mentioned there some of the treatments. Can you give a little bit more in-depth information on what some of the potential treatment options are?
Let's talk about the treatments. So what we're looking for, of course, if we feel on that rectal exam that there's a nodule, something that's abnormal, we will recommend a prostate biopsy often. And also, if we see a PSA, usually when we start at the age that we start screening, greater than 4, if in younger men, then 3, 3.5. When we start seeing the PSA, and then we look at the free PSA as well to see if that's a lower percentage, those are things that tee us off that this person needs a prostate biopsy. Now, sometimes prostate biopsies and screening, we do additional blood tests to see if, the risk for prostate cancer. We do prostate MRIs in some cases before biopsies to make sure that we can target a lesion if there's one there. And then for those patients who are a bit more hesitant against getting a biopsy, maybe they've had biopsies before, we will oftentimes use prostate MRI as part of that screening and that information gathering portion. But essentially, once you get to the point where we're recommending a biopsy, that's often done in the office. Most urologists will do that in the office, and it's done under ultrasound, where we take anywhere from 4 to 16 or more little cores of that prostate tissue and send it for pathology. That prostate tissue is then looked at under the microscope, and the way that the glands and the cells are growing are then graded from Gleason 3 to 5. You get 2 Gleason scores. Basically, we look at the most prevalent types of these cell growth. And basically, if you have all of one type, Gleason 3, then you get Gleason 3 plus 3 equals 6. But if maybe you have a lot of Gleason 4 and you have a lot of Gleason 3, just depending on which one you have more of. If you have more of 4, then you'll have Gleason 4 plus 3 prostate cancer. Sometimes you have more of 3, then it's 3 plus 4. So it's 2 numbers. The first number in those 2 numbers is the one that's more prevalent. It's also, the higher the number is, the more aggressive it is. And you've got to have a Gleason score of 6 or higher to be considered to have prostate cancer. So Gleason 2 and 1, that's not really if those aren't really considered prostate cancer. So it's a few things that we look at for diagnosing prostate cancer, and then based on how aggressive it is, then we talk about the treatment options. So when you have low risk prostate cancer, so that's Gleason 3 plus 3, those are that Gleason 3 is the lowest, and you've got that basically throughout. And maybe you had that on one little core of the 12 that we got in with our biopsy sample. Your PSA is 4, it's not that elevated. You may be a candidate for something called active surveillance, in which we just watch the prostate cancer by doing blood tests routinely and then biopsies every year to two, just to see if it gets more aggressive. And the reason many times people are asking, well, if you find the cancer, why would you not just treat it? And it's because, unfortunately, prostate cancer treatment comes with a lot of morbidity. While we're saving your life, we also know there's a lot of side effects that can come with prostate cancer treatment. When we look at erectile function, when we look at urinary function, when we look at some of the side effects that can just happen, and the risk that can happen in treatment with surgical complications and radiation. So there's always a something that we want to discuss with our patients, looking at their lifestyle and making sure they understand the risks and the type of the prostate cancer they have. And many people with low risk prostate cancer would choose to just watch it for a time. When we start getting into intermediate risk prostate cancer and higher, then we start talking about more of those curative treatments. The mainstay treatments are surgical removal of the prostate or radiation to the prostate. There are other treatments that you can sometimes get at, these much more advanced urology centers and cancer centers, where they can do some more focal treatments. But in general, it's either removal of that prostate or radiation of the prostate.
Wow. So when you say radiation of the prostate, is that the same as the brachytherapy seeds?
Yeah, so there's a few different ways to radiate the prostate, and that's a good point. So when we talk about radiation, usually then we'll send you to as a urologist, we'll send our patients to a radiation oncologist who will talk about whether they're talking about brachytherapy and seeds versus radiating the entire prostate, and basically how many treatments you would need based on the location, the what's the word I'm looking for? Aggressiveness of the tumor. So it's always, a discussion based on the risk factors and the type of prostate cancer you have.
Right, that makes sense.
Mm.
What can you tell us about the prognosis?
Yeah, so when we catch this and it's organ confined, surgery is usually curative. Oftentimes, radiation therapy, when it's organ confined, we can target that lesion. That's also very often curative. So prostate cancer has a very high cure rate when we catch it and it's in the prostate. It's once it starts to spread, we then need to start talking about some of those adjunct therapies, doing longer term chemo and immunotherapy. And then it really all depends on your general state of health, how advanced it is. So it becomes more complex. But so we really try to catch it when it's confined to the prostate, so that we can get you cured.
Have the best possible outcome. Well,
Absolutely.
thank you so much, Dr. Shenelle Wilson. This was really informative. Is there any particular takeaway message that you'd like the viewers to know about prostate cancer?
Yeah, I mean, really, the bulk of our conversation has been about screening, and that's really what I want to take home. Because you hear how prostate cancer, it's really not just, oh, you've got cancer, so this is what we do, but it really depends on where you are in life, your overall health, how aggressive the prostate cancer is. The main thing I can say is make sure that we catch it early. So if you are 50 and you're a male, you should start getting screened now, or you're older. If you've got a family member, a father, an uncle, blood related, of course, who got prostate cancer at an earlier age, if they got it at 50, or if you're Black, you should have a conversation with your urologist and start getting screened around age 40 to 45. And so really it's just catching it early and then making sure that you stay in touch and on top of things with your provider so that you can get a treatment that really fits your life.
Fantastic. Very good information. Dr. Shenelle Wilson, I want to thank you so much for joining the coalition.
Well, thank you for having me.
Of course. I'm hopeful you'll come back another time. For viewers that would like to learn more about you and get connected, what is the best way for them to contact you?
Definitely. Well, I have a solo practice in Kennesaw, Georgia, Metro Atlanta Urology and Pelvic Health Center. So they can always reach out if they're interested in getting treatment. I'm, of course, on Instagram at Shenelle Wilson M.D. and on Twitter at Shenelle. And, just the multiple social medias with my name spelled very uniquely so folks can find me.
Wonderful. Well, thank you so much, Dr. Wilson. We'll see you next time.
Definitely. Thank you so much for having me.
Well, everybody, thank you so much for tuning in to another impactful episode of The Coalition. You can stay connected with me at www.drshanibelgrave.com. You can get connected with Dr. Shenelle Wilson at Metro Atlanta Urology. You can check her out on Instagram. Thanks for watching. I'll see y'all next time.
Be sure to share this episode to raise prostate cancer awareness.